Good afternoon. My name is Patrick Rutter from the School of Public Health, Department of Environmental Health. I'm taking you through HIV and AIDS. That is the ECU 004. The title HIV and AIDS and Drug Abuse. So we shall going to start from the lesson 1, from the introductions. And then from the introduction, we are talking about, in this section, aimed at introducing you to the public health and hygiene. Also, you shall look at the HIV and AIDS. By doing so, you shall be also looking at giving the meaning of this HIV and AIDS, the relationship, the origin, and the classification. The section will also discuss the relationship between the spread of HIV and sexually transmitted infection. We shall look at the objectives of this unit, and by the end of this section, the learner should be able to describe the importance of public health and hygiene in HIV and AIDS issues. We shall also explain the relationship of HIV and STIs. We shall look at explain the origins and the classification of HIV and AIDS. Another objective is explain the relationship between HIV and sexually transmitted infections, that is the STI. So we shall look at the public health. What is this public health? And we'll say that the public health is defined as the protection and the improvement of health of the entire population through community-wide action, primarily by the government agencies. We shall also define the HIV. We can say it stands for human immunodeficiency viruses and the virus that causes AIDS. STI stands for sexually transmitted infection or disease. AIDS stands for acquired immunodeficiency syndrome, and hygiene is defined as the science of dealing with the prevention of health or the practice of principles of cleanliness. Let's look at the public health and hygiene. And we're saying that the goal of public health are comparable to those of HIV and AIDS in education, and they include, for the first one, to prevent human diseases and injury and disability. So the first functions of public health is to prevent human diseases, injury, and disability. Also, it enables or protect people from environmental health hazards. There are so many hazards that we have in our environment or in our community, and it's very important for public health to ensure that people are protected from these environmental health hazards. The next objective, number 3, is to promote behavior that leads to good physical and mental health. It's also an important function of our public health. The other one is to educate the public about health and issues, availability of high quality health services, especially between our community. Let's look at this another function of public health, vaccination. And this is a very important function of our public health programs. This is the deliberate process of making the body resistant to a specific disease by using a vaccine. So this program is very essential to public health because the public health should be able to prevent. They are the forefront in prevention of diseases. So they must be having the vaccines so that they will be able to immunize the community against certain diseases. For instance, if it is in an MCH, for example, the measles, it is important to immunize children against measles. The other function or the program for public health is rural and urban health clinic. And we are saying that public health agencies operate local clinics that provide free or reduced cost medical services to individuals, especially infants and children, the pregnant and nursing women, people with drugs abuse problems, physical disability, and other conditions. The other program for public health is disease tracking and epidemiology. It is important for public health to track the disease. So this program is housed in the public health to ensure that public health officers are also involved in the epidemiology. Threats to public health concerns changes over the time, and epidemiologists and other officials continuously evaluate epidemiological trends to determine how best to meet future public health needs. So the work of this public health program to ensure that the diseases, or they participate in disease surveillance to ensure that within a community, what kind of ailment and what percentage or the proportion. So that if there is new coming up of a disease, they will be able to protect the public and also be able to control the disease. The other program housed in the public health is the sanitation and pollution. And we say that disease-causing organisms are often transmitted through contaminated drinking water. The single most effective way to limit waterborne diseases is to ensure that drinking water is clean and not contaminated by the sewage. And in many parts of the world, public health officials establishes sewage disposal and solid waste disposal system and regularly test water supplies to ensure they are safe. So this sanitation and pollution control, it is the program under the public health to ensure that the community or the public or the citizen are drinking water which is safe. They will be able to monitor in terms of the treatment, how frequently the drinking water is being treated, and in what way, and what chemicals are they using to treat the water. So the main functions of the public health is to monitor. They will also take samples. They ensure that the sewage system is according to the public health, so that there is no contamination or the pollution of the environment. Because if there is any spillage of a sewage, they will lead to the underground water pollution, and also it can pollute the environment, and there is high chances of diseases are coming up. Many diseases such as hepatitis and these caused by bacteria are transmitted through food. So it is a function also of public health to ensure that the food kiosk or the restaurant itself, those people working there, they are having medical checkup, or they are being checked up, so that to ensure that they do not transmit this disease like hepatitis A and so many others like the cholera or even the typhoid. So it is very important for the public health to ensure that those people working in a food kiosk, they're having medical certificate. So they have that, they have given that duty to serve the public. We continue saying that when food is not washed or thoroughly cooked, or when food is stored at temperatures that are hospitable to disease-causing organisms, people who eat the food are subjected to infection. So this also is very important for the public health. So when they are going around for checking in terms of the food industry, they ensure that if there is anything left over of the food or in the manufacturing industry, they do have the fridge to ensure that they keep their food safe. And when you talk about the food keeping safe, for how long, at what temperature, is it being controlled? So those things are very important, and the work of the public health is to ensure that there is someone monitoring. They do have the schedule, the list, and at what time, and this kind of food, at what temperature we are supposed to keep it. Environmental pollution is another preventable cause of disease and disability, and in most countries, public health officials addresses the adverse health effect of air and water pollution. As we know that environmental pollution cannot be only by water, it could also be by air and so many other things in the community that will make the community not fit, or water which is being present in the community not fit for use. Another program under the public health is the medical research. You're saying another component of this public health is scientific and medical research. Cadres of doctors and scientists work in laboratories to establish new ways to prevent, diagnose, treat, and cure diseases and disability. So the public health, they also come up together with other cadres to ensure that there is a continuous research, because there are so many strains of diseases. So they will have to be up to date on how the disease evolve, and a new strain of diseases, when they are coming up, they should be aware. So they must participate with other departments in coming up with the research, to research on so many diseases. They also investigated the safety and effectiveness of existing pharmaceutical and treatment programs, and tested the safety of hundreds of the products that we use every day. And also, this is also very important. When the public health are going around, either to the supermarket, to the pharmacy, and also to the factories or the industries, they do also decide, because when they go there, they take the sample. After inspection, take the sample, take to the public chemist, analyze that, and check that. Is it fit for human consumption? Is it posing any risks to the public? So it's another work for the public health. And you say that many diseases are preventable through health living, and our primary public health goal is to educate the general public on how to prevent the non-infectious diseases. So it's very important to ensure that these many diseases, they are very much preventable, but we want to know how to prevent these non-infectious diseases. Also, they participate in health promotion by encouraging people to take advantage of highly diagnostic tests that can make the outcome of disease more favorable. And this was cited by the press in 1986 to talk about health education. Let's look at the relationship between the HIV and AIDS and STIs. STDs enhance HIV transmission. This is by the Cohen in 1998, by causing open sores and skin injuries in sex organs through which the HIV enters. So STDs, they can enhance the HIV by causing open sores and injuries in sex organs through which the HIV enters. As we know that if they have any opening in the skin, especially maybe it's through the penis or through the sex organs, they enhance this penetration of HIV or the virus itself. A lot of the T lymphocytes are mobilized to fight the STDs infections, and since these are the target of HIV, a lot of them are destroyed, and the person or individual goes down faster with the HIV. So we are saying that the lymphocytes, remember these are white blood cells, they accumulate in those cells, and these are the lymphocytes are the target cell for the HIV. So meaning that they destroy these white blood cells. When they destroy the blood cells, meaning that the immune system of our person is reduced or it is compromised. The mode of transmission for the STDs is also the same as the mode of transmission of HIV. So these STDs, they are infectious. So they can be transmitted from one person to another through contact or body fluids. So the same case with the HIV, they can be transmitted through all those areas. Let's look at the origin of this HIV. What is this HIV? We are talking about this monster, and we are saying that when and where the HIV virus first emerged is probably going to remain a mystery for many years to come. Why? While several theories have been put forward, there is no conclusive single agreement on the origin of HIV and AIDS. Some of the mostly acknowledged theories about the origin of HIV include the following. Because we wanted to know what is this kind of HIV, this monster. So we wanted to find out there are so many theories trying to explain what is the HIV and AIDS. And we are saying that the first one is the mysterious origin theory. And in this theory, it tries to account for the seemingly mysterious origin of HIV. By locating it out of this world, it suggests that viral materials was carried in the tail gases of the comet passing close to the Earth, and that is the material was deposited, subsequently infecting nearby state in people. Although one of two famous astronomers have been linked to this theory, in the popular press, these scientists deny the possibilities of these extraterrestrial phenomena and only personal connection to the theory. Now let's look at also the second theory. When we are talking about the religious theory, or talk about God of witchcraft, this thing comes maybe because of God was very hungry, or it could be the witchcraft. So we are saying certain segments of the population have openly stated that AIDS is God, since the scripture condemned the homosexual practice in which AIDS was first observed in Western world. Rather than this being considered as a visitation from God, many Africans believe that AIDS is caused by another supernatural power. Like, for example, talk about the witchcraft, and they are anti-witchcraft ritual objects to counteract the infection. So when you look at the biblical point of view, we talk about the religious theory, those believing about God, and say that God was very hungry, and that is why there was this disease. Let's look at that theory. We talk about the monkey origin theory. And this, we talk about the lentiviruses, are in turn part of the larger group of viruses known as retroviruses. The name lentiviruses literally means slow virus because they take such a long time to produce any adverse effect in the body. So this theory tries to explain that this is the virus, the HIV virus came from the monkeys, because these are retrovirus or the lentivirus. They took more time before we realized that this is the disease itself. They have been found in a number of different animals, including cats, sheep, horses, and cattle. The most interesting lentiviruses in terms of the investigation into the origin of HIV is the simian immunodeficiency virus that affect monkeys. So this we talk about this theory of monkeys. So we talk because this has been found in monkeys, although it also has been found in cats, sheep, horses, and cattle. So there is that interaction between the monkeys also and the human beings, and that is maybe why this theory is explaining about the HIV. The researchers led by the Paul Sharp of Nottingham University and Beatrice Ham of the University of the Alabama made the discovery during the course of a 10 years long study into the origin of viruses. They claimed that this sample proved that chimpanzees were the source of HIV-1, and that the viruses at the same point crosses species from chimps to the humans. So from these famous scientists, they believe that because of this long period of study for 10 years, they believe that these viruses came from the monkeys and also to the humans. So you're talking about the zoonotic diseases, and this HIV could be one of them. Let's look at how HIV have crossed species. Some of the most common theories about how these zoonosis took place and how these simian immunodeficiency viruses become HIV in humans include, we have the oral polio vaccine theory. Remember, this polio vaccine is also a theory whereby orally you take the polio. We also have the hunters theory. We do have also the contaminated needle theory. We have colonialism theory, conspiracy theory, and the calculation theory. All these theories will explain how the disease of HIV spread through humans. Let's look at the oral polio vaccine, or OBV theory. In this book, we talk about the river. The journalist Edward Hooper suggested that HIV could be traced to the testing of an oral polio vaccine called the CHARTS, given to the public, millions of people in the Belgium, the Congo, Rwanda, and Burundi in the latest 1950s. To be produced, live polio vaccine need strains to be cultivated in living tissues. And Hooper's belief is that CHARTS was grown in kidney cells, as taken from the local chimps or chimpanzee infected with the HIV chimps. These then claims will have resulted in the contamination of the vaccine with the chimps slay, and a large number of people subsequently become infected with HIV-1. So you're saying that this polio theory, because the strain needs to be removed from the animal, during that process, because the strain itself needs to be cultivated, so they will have that called CHARTS contamination with that chimp slay infection. Let's look at also the second one. This is the hunters theory. And we are saying the most commonly accepted theory is that of the hunters. In this theory, HIV chimps was transferred to humans as a result of chimps being killed and eaten, or their blood getting into a cut-off wound or onto the hunter. Normally, the hunter's body will have fought off slay, but on a few occasions, it adapts itself within its new human host and become HIV-1. So in this hunter's theory, when they do go and hunt, there's that contamination, or maybe the blood itself could contaminate themselves with the blood. Or we're talking about this transfer of human as a result of chimps being killed. So if the hunters have a wound, there is high chances of the fluid or the blood mixing with that of the hunter. And this taking for a long time, it is producing this as the HIV-1. The fact that there are several different early strains of HIV, each with a slightly different genetic makeups. The most common, which was the HIV-1, is group M, will support this theory. And by saying that every time it passes from a chimp to man, it will have developed in a slightly different way within the body, thus producing slightly different strains. Because the virus is just mutate. It takes time as we go along. It's just mutating, and this theory is just explaining about the hunters theory. We are seeing also an article published in the Lancet in 2004 by Nathan et al. 2004 also shows how retroviruses transfer from primates to hunters is still occurring even today. All these infections were believed to have been acquired through the butchering and consumptions of monkeys and hemp meat. Discoveries such as this have led to call for an outright ban on bush meat hunting to prevent simian viruses being passed to humans. And maybe that is why it's explained why even the government of Kenya, they are banning the consuming of the bush meat until it has been inspected by the maybe the public health, or it could be the vet to certify and say that this meat is fit for consumption. because there we do have these zoonotic diseases, which I say it is being transferred from the human to the from the animals to the human. Let's look at the also the contaminated needle theory. This is the data theory explaining how this HIV spread to humans. This is an extension of the original Hunter theory. In 1950s, the use of disposable plastic syringe because commonplace around the world as a hip sterilized way to administer medicine. However, to African healthcare professionals working on inoculation and other medical programs, the huge quantities of syringe needed will have been very costly. So there is that need of sterilization of the needle. And then we talk about this the contaminated of needle, meaning that there could be high chances of recycling the needle. And in the process of this, trying as much as possible to sterilize, others could be and not be passed through the proper way of sterilization. It is therefore likely that one single syringe will have been used to inject multiple patients without any sterilization in between. This will rapidly have transferred any viral particles from one person to another, creating huge potentials for the viruses to mutate and replicate in each new individual it encounters, even if the HIV within the original person infected had not yet converted to HIV. So because of this sterilized, or there's no good proper way of sterilization, there's high chances of contamination because one needle could be used maybe by 2 people or 3 people, not unlike today. And that is why we have the viruses transferring from maybe talking about from the germs to humans through the contamination. The fourth one is the colonialism theory. It was first proposed in the year 2000 by James Moore, an American specialist in primate behavior, who published his findings in the journals AIDS Research and Human Retrovirus. During the late 19th and 20th century, much of Africa was ruled by the colonial forces. In areas such as the French Equatorial Africa and the Belgium Congo, colonial rules were particularly harsh, and more Africans were forced into labor camps where sanitation was poor, food was scarce, and physical demand was extreme. As we know that in most of the countries, we were being colonized with foreigners, and especially they talk about the Africans, the Congo, whereby these colonial or colonialist people, they are very harsh. So they force people to settle in one place. And when the people settle in one place, there is a public health constraints, whereby we don't have enough water, sanitation, even the environment itself is polluted. These factors alone will have been sufficient to create poor health in anyone. So HIV could easily have infiltrated the labor force and taken advantage of their weakened immune system to become HIV. So since it has been transferred from the SIV, of the Sylvian immunodeficiency virus, it transferred to the humans. Remember the people that time, when they were being colonized, or the African was being colonized, put them together, they will be having, because of harsh labor, the immune system become low, and because of this no enough water or the clean water, the high chances of this disease to sprout will be very high. And that will be explaining why this disease persons spread. I mean, a stray of perhaps 6 chimpanzees with SIV will have made a welcome extra source of food from the workers. More also believe that many of the laborers will have been inoculated with unsterilized needle against disease such as smallpox, and that many of the camps actively employed prostitution to keep the workers happy, creating numerous possibilities for onwards transmission. Perhaps this could be also the reason, because I say that when people are in one place, these public health or this constraint of public health services. So this kind of the prostitution could have led to the spread of this HIV. The next one talking about is a conspiracy theory. We are saying that some of that HIV is a conspiracy or that it is a man-made with an interior motives. Conspiracy administered theory have blamed Germans' biologists' welfare all the way back to the days of Nazi and other dominants in Germany for the escape of HIV infection or infecting agents. Americans who believe HIV was manufactured as part of the biological welfare programs designed to wipe out large number of blacks and homosexuals people. So these conspiracy theories, this traces back. When we talk about the Nazi, for example, when these people, the slaves, they were used as a guinea pig, or these are way that they will not get proper treatment. So these people were, when you talk about the Nazi theory itself, it is a very harsh way, even though they were doing research, but they did observe the ethics in research. And maybe that will explaining these conspiracy theories, because even America, they believe that. These are a way of introducing the disease so that they can wipe out the blacks and also the homosexuals. Let's look at the coagulation theory. This is the latest theory on the origin of HIV. Opponents of the simian human transmission remain unimpressed by the evidence in of the monkey's theories and argue that viral sequencings of HIV strain indicated that HIV has been around probably for hundreds of years. In 2000, when a team of scientists using computer technologies to study the structure of HIV calculated the rate at which the viruses mutate from the HIV viral subtypes to have a common ancestor. And they believe that this is a calculated theory. And it is the HIV just changes very fast. When they were using the computer to find out what could be the reason, and we talk about this HIV could have been there for many years. And because of the mutation or the change, it did lead to HIV that we had today. So yes, continue saying that this process revealed HIV originated around 1930s in the rural area of the Central Africa, where viruses may have been present for many years in isolated communities. The virus probably did not spread because members of these rural communities had limited contact with people from other areas. So they believed that the disease was still there. Or in the year 1930, in a certain rural place in Central Africa, that is a small group. So it was not spreading because there could have been no contact with the other communities. It was isolated the community. But in the 1960s and 1970s, political unbelief was drought and famine forced many people from these rural areas to migrate to cities to find a job. During this time, the incidence of sexually transmitted infection, including HIV infection, accelerated and quickly spread throughout Africa because of the urbanization. In the year 1960s and 70s, we have those wars, we have drought, we have famine, and so many others, industrialization. So they have that people moving from rural areas to the cities, searching for a job or employment. In the process, many people engage in a sexual behaviors, like the prostitution, maybe looking for the money and so forth. And that led to the spread of the HIV. Let's look at what causes the rapid spread of HIV. We are saying that there are a number of factors that may have contributed to the sudden global spread of HIV in the latter half of the 20th centuries. They include the international travel. When people travel from one country to another, they will get maybe, we have the socialization. And because they are more than that socialization, they might lead to the high spread of HIV. If one slept with an infected person, that person become infected. We also have the blood industry, whereby we talk about the blood transfusion. If there could be the contamination, and the other partner will be able to get the HIV. Or if there is no proper screening of the blood, the one receiving the blood could be a healthy person, but the blood which is being supplied to that person could be having the disease, and that can lead to the high spread of the disease. The other one is the widespread drug use. As we know that, the drug users did not care much about HIV and AIDS, or because of the drugs they are using, they could be a reason, or they might not even think properly. And when they engage in sex, or when they are using the needles, that can lead to the spread of this HIV. Let's look at how is HIV spread. HIV and AIDS is transmitted through the following ways. We have a sexual contact with a person infected with the virus, from an infected mother to her unborn child in the womb, during birth, or soon after birth. We also have transfusion with infected blood or blood products. So those are some of the ways or how HIV spread. HIV contaminated cuttings and skin piercing instruments, e.g. needle, the wrestle, the knives, and so forth, even during the circumcision. Occupational exposure, like for medical personnel, can also lead to the transmission of diseases if they don't have the proper PPEs. Sharing the toothbrushes, if one has bleeding gums, a person can be able to get the HIV. Deep kissing, if one has open wound in the mouth, especially if both partners could be having maybe a wound, could lead to the this deep kissing. We talk about the deep kissing. How is HIV not spread? And HIV is not spread through everyday social contact, such as maybe handshake, living together, playing together, eating together, working together. Those are the ways that one may not contract HIV. It is also noted by eating and cooking utensils. Instances like the mosquito cannot spread the HIV. Toilet seats, coughing and sneezing may not cause the spread of HIV. Let's look at the signs and symptoms of AIDS. AIDS progress through the following stages. We have 4 stages for the progression of the HIV, and one is a symptomatic stage, whereby during this stage there are a number of symptoms. The virus can only be detected through a clinical test. So unless one is subjected to the clinical test, you may not know that person is having the HIV, because this talk about asymptomatic stage. It goes to the second stage when you talk about the AIDS-related complex or ARC stage, whereby this stage is a complex because there are many problems evidence at the same time. Maybe one like maybe coughing, sneezing, being in an hospital in and out, and so forth. And these are the following. We talk about the weight loss, high fever, night sweats. We have also the enlargement of the glands or lymphadenopathy, whereby there's enlargement of the lungs or the organs. AIDS-related complaints are mainly due to the antibodies. I talk about the B cells. We talk about the white blood cells. Fighting the AIDS viruses and other viruses, especially the herpes virus group, which normally attack the body as soon as the immune system goes down. We have the B cells, and these are the antibodies. Also, these talk about the white blood cells being attacked by the HIV virus. The ACT stage is therefore characterized by a win or loss battle between the B cells and the AIDS virus until finally the body becomes overwhelmed when few B cells give up. So at this stage, you talk about the fight between the HIV and also the B cells. And remember that we are saying that when there is any infection, the B cells will be so many at that area. And that could lead to the area whereby the HIV will be able to target. Let's look at also the that stage, whereby talk about AIDS full-blown stage. This stage is characterized by frequent opportunistic infections like TB, fungal infections. We have pneumonia. We have certain cancers like Kaposi sarcoma. The patient is hospitalized on and off, weight loss and sick looking. And the last stage, the fourth stage, is the death. During the process from infection to death is 4 to 8 years. Most of the children present the symptoms within the first 2 years. This is because their immune system is immature. But this, of course, today, the length has gone, it's big, because of the introduction of ARVs. So a person can live even up to 15, 20 years, so long as it's taking the instruction correctly and take the medication as required. So that is the end. This is the assignment 1. And you're saying that these are for the student to present a brief history on the discovery and the spread of AIDS. So they have to explain briefly about the HIV. The second one is explain the strategies used by the public health officers to curb the spread of infectious diseases. Using a suitable example, differentiates between the STIs and STDs. And the last one describes various theories expounding on the origin of the HIV. End of the lesson 1. Thank you and keep safe.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.